Hello,
Hi.
my name is Valerie Wright, and I'm going to be providing care for you today.
Okay.
I'm a family nurse practitioner,
Okay.
and I'm able to, I've had education and training to be able to treat you, to diagnose, to
Okay.
write prescriptions, and to provide care for you today.
Okay.
Okay, and can you tell me your name
Samantha Hughes.
and how old are you?
I am 22.
You're 22, and your birth date?
January 13th of 98.
Okay, and are you single or married?
I'm single.
Okay, and are you in a relationship with anybody at this time?
No.
No. And what do you do for work?
I'm a CNA.
Okay. And are you in school or are you just working as a CNA?
I go to nursing school part-time.
Okay, great. Um, and do you feel like you can give me a history? And we're just going to assess you today. Your health, all over health.
Okay. Yeah, that's fine.
Okay. And what are we seeing you for today?
Just a regular adult checkup.
Okay. And how are you feeling and like in your overall health? If you had to explain how you're feeling as a person.
I feel healthy. A little stressed out just because of school, but other than that, I feel overall healthy.
Great. Great. And then when was the last time you saw a doctor or an advanced
I would say about 6
provider?
months ago.
6 months ago.
Mm-hmm.
And what was that for?
Just a routine checkup.
Okay. Okay. And where did you go to get this?
I went to Swedes.
Swedish American?
Mm-hmm.
Okay. And did they do any tests on you?
No, they didn't. It was just a refill for medication, really, but they also just made sure I was feeling okay.
Okay. Okay. Do you have any concerns right now? Any health care related concerns
No,
besides some of the anxiety and stress?
right, but no, other than that, no, I don't have any other concerns.
Okay. Can you tell me, we're going to discuss some of your past
Okay.
medical history. Immunizations, are you able
Yeah,
to get those?
I should be up to date on all of them because I just had to get them for nursing school in January of 2019.
2019. So
Mhm.
tetanus is updated.
Yep,
And how about your hepatitis?
yep.
Okay. And TB?
Yeah, I need a two-step in January of 21, but
Okay. How about influenza? Do you get those?
yes, I get the flu shot every year.
You do.
Mhm.
And did you get the flu at all in the last couple of years?
No. Mm-mm.
Okay, so you felt it protected you.
Mhm.
All right. How about pneumonia? Do you get a pneumonia vaccine?
I don't know for sure if I got one or not. I should have one though.
Okay. And your childhood immunizations, were they?
Yeah,
Did
they
your
were all
parents?
up to date.
Okay,
Yep.
great. And as far as recent, I know you were CNA, so
Mhm.
any recent exposure to a communicable disease such as hepatitis B, tuberculosis,
No.
and right now, obviously, there's COVID.
Right. We get tested weekly. And I
Okay,
haven't
great.
came in contact with
Great.
anyone.
As far as allergies go, we're not just talking about medicational allergies, we're talking about food allergies, latex, medication, environmental, seasonal, so it's kind of
Okay.
a combination of allergies. Do you have any allergies?
I just am allergic to sulfa.
Sulfa?
The medication, but other than that, no, I don't have any other allergies.
Okay. And what happens when you
Just
take sulfa?
GI upset and diarrhea.
So it's more of an intolerance?
Yes, I haven't. Yeah, I would say intolerance than anything.
Okay, great. Um, Now we're kind of going to go into your hospitalizations and surgeries in your past.
Okay.
Have you ever been hospitalized?
Yes, I have. I was about 8. I was hospitalized for kidney infection and pneumonia when I was
Okay.
around 8. I believe.
Okay. And as far as your past medical history, have you been diagnosed with certain issues in the past?
I was diagnosed with asthma as a child.
Okay.
Um, and I got some kidney infections regularly, but other than that, I don't know. I wasn't diagnosed with anything else.
And as far as your asthma goes, do you still take current medication for asthma
No.
medications?
No, I stopped around like 13. I stopped taking.
And you were diagnosed at what age with asthma?
As a baby, almost.
Okay.
Yeah.
And as you got older, do you remember the treatments besides an inhaler? Did you have any other treatments for your asthma?
I took steroids and I did nebulized treatments.
Okay, and then inhalers, you said.
Inhalers.
And your kidney infections, was there any treatment for those or any testing done?
I got a CT of my kidneys done, and I was hospitalized for about 6 days. But I was just treated for the kidney infection with antibiotics. But I'm
Okay.
not on any medications for my kidneys or anything.
Okay. Do you still get UTIs?
Not as regularly as I used to, but sometimes.
Sometimes.
Mhm.
Okay. All right. So at 8 years old, you were hospitalized for the pneumonia, asthma complications, and kidney. So it kind of all came to a combination when you were 8.
Yes.
Okay. Any surgeries in your past?
No.
No surgeries. Okay.
None.
Okay. And current medication right now that you're taking?
Just birth control.
Birth control. And
Mhm.
at what age did you start taking birth control?
16.
At 16.
Mm-hmm.
And was the reason to prevent pregnancy, or was there other reasons for taking birth control?
It was to regulate my menstrual cycle and to make it not as heavy. I was
Okay.
bleeding a lot.
Okay, so you have a lot of bleeding.
Mm-hmm.
Okay. And we're going to kind of switch to injuries and accidents. So any accident injuries, sports injuries?
I dislocated my right shoulder in basketball in high school, but other than that,
And what age were you?
I was like 15.
You were 15.
Mhm.
And what was the treatment? What happened at that time? Excuse me.
I was, it was put into a sling, and I think they just put it back into place, and I did physical therapy.
And who put it back into place?
OSF did. I just can't think of the doctor. Rockford
Okay.
Orthopedic, I would assume.
So you followed up with Rockford Orthopedic,
Yeah.
and you did physical therapy.
Yes.
Do you have any restrictions with that shoulder?
No.
So you've healed completely?
Mm-hmm.
Okay, great. Any other accidents or harmful ingestions, like accidental taking of any sort of medication